Hello, I'm Nick the nurse. Today we're going to be talking about obsessive-compulsive disorder, or OCD for short, as it relates to nursing in the mental health setting. Now, obsessive-compulsive disorder, or OCD, is a disease that's characterized by obsessive thinking and repeated behaviors. For example, somebody who has obsessive-compulsive disorder might repeatedly flick the lights on or flick the lights off in an effort to reduce their anxiety and gain control over their situation. Another example might be where you have a patient who washes their hands repeatedly, even though they haven't touched anything else, and they might wash their hands several hundred times a day. Now, for us nurses, that actually might happen, but this is for somebody who, might just be at a desk all day and they feel the obsessive need to do so. The reason that the patient tries to have these, or not tries, but the reason that this patient has these repetitive behaviors and obsessive thinking about them is because they're trying to regain control and exercise control over their behaviors in an effort to reduce their anxiety. And the reason, it doesn't end up working when they go to flip the light switch off or they check the kitchen stove repeatedly over and over and over again, and they do that in an effort to get control. But ultimately, they're unsuccessful in getting control, and it leads to more anxiety in the patient. So what we as nurses need to do is we need to learn to help the patient reduce their anxiety. And there's a lot of different ways that we can do that. Obviously, we need to use therapeutic nurse communication techniques. Sometimes we can use pharmacological therapies, and we can also use certain types of therapy, such as cognitive therapy or perhaps even group therapy, if the other person needs to know that other people can suffer from the same types of psychological stressors. Whatever we do, we want to make sure that we don't interrupt the repetitive processes and behaviors of the patient who has an OCD episode, because by doing that, we'll only frustrate and further increase the anxiety in the patient who's suffering from OCD at that particular time. So we want to make sure that we allow them to finish their repetitive behaviors because we don't want to frustrate them. That will only lead to more anxiety. And at that point, we can then use regular therapeutic nurse communication techniques. My name's Nick the nurse, and I want to thank you for viewing our video today. We'll see you next time.